If you care about your penis, this video is for you. I'm Dr. Rosie Adams, and I'm a board-certified urologist dedicated to men's health. Today I want to talk to you about 10 critical things you should never do to your penis after 40. As a urologist specializing in men's sexual health, I've made it my mission to help men understand that penile health isn't just about function. It's about quality of life, longevity, and overall well-being. In this video, I'm going to share 10 essential insights that could literally change your life. And I really want you to stick around until number 10, because that one is going to surprise you and challenge everything you think you know about maintaining your health as you age. Now, before I dive into this content, I want to ask you something important. If you've been following my work, if you've found value in my other videos, please make sure you're subscribed to this channel. And if you are subscribed, please hit that notification bell because I'm producing educational content consistently, and you don't want to miss what could be the most important health information for you. I know that only about 20% of people watching are actually subscribed, and I'd really appreciate it if you'd join our growing community. Share this video with your friends and family because men need this education. So many of you are suffering in silence, and it doesn't have to be that way. Number 1. Don't ignore your penis. This might sound simple, but it's one of the most important points I'm going to make today. Many men don't realize that the way your penis functions is actually a barometer of your overall health. Think of it as a warning system for your body. When I look at men who develop erectile dysfunction and I follow their health trajectories over the next 7 years, studies show that 14% of them go on to experience a heart attack. This is why we in the medical field call erectile dysfunction the canary in the coal mine. It's not just about sex, it's a critical marker of your cardiovascular health and overall well-being. When you have strong, healthy erections and robust sexual desire, that tells me several important things about your body. First, it tells me you have excellent blood flow. Your cardiovascular system is functioning properly. Second, your hormones are balanced and working as they should. Third, your nervous system is in good health. Fourth, your psychological state is solid. You're not carrying excess stress or anxiety. And finally, it indicates you're not engaging in behaviors or substances that would harm your sexual health. This is why ignoring changes in your sexual function is dangerous. Your penis is talking to you. You need to listen. Number 2. Don't DIY things for your penis. I've seen it all in my practice, and I want to be absolutely clear. There is no safe at-home remedy that will make your penis longer or thicker. There is no magic potion, no special oil, no secret technique that will make it grow overnight, regardless of what advertisements promise you. I once saw an advertisement claiming that apple cider vinegar would dramatically increase penis size. It doesn't make physiological sense, but I understand why men try these things. There's real desperation around sexual health and body image, and that desperation makes people vulnerable to false promises. The problem is that most of these DIY approaches are unproven, unsafe, and can cause serious, permanent damage. Let me give you specific examples from my clinical experience. The first is gelching. Gelching involves using hand pressure and stretching motions to try to increase penile length. Here's the problem. When men do this excessively, and trust me, they do, they create tiny fractures and injuries throughout the penile tissue. Over time, this cumulative damage can lead to erectile dysfunction and chronic pain. I've seen far too many young men come to my office with gelching-induced injuries they'll carry for life. Another dangerous DIY approach is using homemade constriction bands. I had a patient come into the emergency room who had wrapped a construction nut around his penis. He was intoxicated when he did it, lost consciousness, and by the time he arrived at the hospital, his penis was so severely swollen that we had to call the fire department to use a reciprocating saw to remove it. I'm not exaggerating, this actually happened. Another case involved a man who had cut a ring from a plastic Coke bottle and got it stuck around his penis. These situations are painful, humiliating, and can cause permanent damage. If you want a constriction band, buy one. You can get quality, medical-grade constriction bands on Amazon for about $20. They're designed to be removed safely and easily. Your penis is too important to risk on DIY solutions. Number 3. Keep it clean. But don't be aggressive. Everyone knows they should keep their genitals clean, but many men don't understand the nuances of proper penile hygiene, especially after 40 when things change. If you have a foreskin, this is critical. You need to regularly pull your foreskin back and clean underneath. Many men forget to do this or can't do it because the foreskin is too tight. If you can't retract your foreskin, that's a medical issue that needs addressing. Why is this important? While penile cancer is exceedingly rare, it does happen, and I've seen cases where men couldn't pull back their foreskin, so they couldn't see the cancer developing until it was too late. If you're unable to retract your foreskin, talk to your doctor. This can often be treated with creams, special devices, or circumcision if necessary. Now here's the other part of this equation. Don't be aggressive when cleaning. I see men who use harsh soaps, scented products, and aggressive scrubbing. The skin on your penis is delicate and not meant for aggressive washing. This kind of harsh cleaning can cause irritation that can lead to lacerations and ongoing problems. What you should do instead is use lukewarm water with gentle soap. Let soapy water run over the area. Make sure there's no smegma buildup. Keep it clean but keep it gentle. Your touch should be kind and careful. Number 4. Don't ignore pain or warning signs. This is one of my most important messages. If something is wrong with your penis, see a doctor immediately. Please don't ignore it. Pain, discharge, blood in the urine, unusual growths, ulcerations, or any kind of abnormality could indicate several things. It might be a sexually transmitted infection. It might be a urinary tract infection. It could be a sign of kidney stones or bladder stones. Blood in the urine could indicate bladder cancer or even penile cancer. I know it's difficult. I know it feels vulnerable to show your genitals to a doctor and explain what's happening. You might worry about judgment, especially if the issue stemmed from unprotected sex. But I want you to understand, that discomfort is not worth risking your life. If you feel judged by a doctor, find a different doctor. But please don't delay seeking medical care. The saddest cases in my career have been men who ignored ulcers on their penis because they were scared, only to be diagnosed with advanced penile cancer. Penile cancer is rare, but it's extremely aggressive. I've seen probably a handful of cases throughout my entire career, but when it happens, it's devastating. The key is this: if you catch these problems early, the interventions are far less invasive. Early treatment means preserving function and health. Waiting means potentially losing much more. Number 5. Stay in control and be safe. Let me tell you something, and I mean nothing sexier than safe sex. Think about it. When you're with a partner and you're not worried about sexually transmitted infections, you're not worried about unwanted pregnancy, you can be completely uninhibited. You can be vulnerable. You can focus entirely on pleasure and connection. That's when great sex happens. So always prioritize safety. There are so many condom options available. You've got to experiment to find the ones that work best for you. Some men prefer thinner condoms for better sensation. Others prefer specific textures or materials. Involve your partner in this process. Make it fun, make it exploratory, but always make it safe. Beyond condoms, there are other safety measures. Dental dams, testing, communication with partners about sexual health. These aren't romantic killjoyers. They're the foundation of genuine pleasure. Now, the other aspect of staying in control is about physical control during sex. Here's why. Penile fractures are real, and they're traumatic. A penile fracture occurs when your erect penis bends in a way it's not supposed to. This often happens during vigorous sex, when the penis accidentally hits the pubic bone instead of entering the vagina. There's often an audible popping sound, severe pain, and rapid swelling. This is a surgical emergency. If this happens to you, go to the emergency room immediately. We need to get you to surgery to repair the tear in the tunica albuginea, which is the tissue that surrounds the erectile tissue. If you don't repair this surgically and you wait it out at home, about 50% of men will develop erectile dysfunction later. But if you get immediate surgical repair, you can maintain normal erectile function. How do you prevent this? Stay in control. Hold your partner's hips. This gives you command over the speed and angle of movement, reducing the risk of accidents, and use plenty of lubricant. I cannot stress this enough. Let me address something important about lubrication. If there isn't enough natural lubrication, it doesn't mean your partner isn't aroused. As men age and as women age, lubrication changes. Women going through perimenopause and menopause experience decreased lubrication. Younger women might have less lubrication due to medications, genetics, hormonal birth control, or various other factors. Adding lubricant makes sex more enjoyable for both partners and prevents injury. There's nothing wrong with it. Number 6. Don't make it hot. Here's something many men don't think about. Your testicles need to stay cool. The reason testicles hang outside your body, whereas women's ovaries are internal, is because sperm production requires a very specific, relatively cool temperature. When you expose your testicles to excessive heat, and I mean wet heat specifically, like from jacuzzis, hot tubs, saunas, and steam rooms, this can affect your body's ability to produce sperm. This can lead to infertility problems. It can also potentially affect your testosterone levels, which impacts everything from your sex drive to your muscle mass to your overall vitality. What should you do? Limit your exposure to extremely hot environments. If you love hot tubs and saunas, enjoy them occasionally, but don't spend excessive time in them. Also think about daily habits. When you're sitting at a desk working on a laptop, Try to have something working on a laptop. Try to have something between your genitals and the laptop. And here's something people don't talk about enough. Keep your phone in your back pocket, not your front pocket. All electronic devices emit heat, and that heat right against your genitals all day long can affect testicular health. These might seem like small things, but after 40, maintaining healthy testosterone and sperm production becomes increasingly important for your overall health and vitality. Number 7. Be nice to it. What do I mean by this? I mean be gentle when you masturbate. Avoid what I call the death grip. Masturbating with excessive force and pressure. Here's the problem with the death grip. Your hand can apply pressure and intensity that a vagina, a mouth, or any other part of a partner's body simply cannot replicate. When you regularly masturbate with this kind of intense aggressive grip, your body becomes habituated to that sensation. It becomes adapted to that level of stimulation. Then, when you're with a partner, you find that normal sexual activity doesn't provide the same intensity. You might have trouble getting aroused. You might struggle to maintain an erection. You might have difficulty reaching orgasm. Your partner feels inadequate, and you feel frustrated. What I'm encouraging is this. When you masturbate, do it in ways that mirror how you'd be aroused with a partner. Use lubricant. Focus on pleasure rather than speed. Don't approach it as something shameful that you need to hide or rush through. Make it a healthy, normal part of your sexual expression. This mindset shift, from aggressive to gentle, from rush to present, can transform your sexual health and your relationship. Number 8. Don't smoke and take care of your health. Let me be direct. Smoking will destroy your erections. 100% of the time, smoking damages erectile function. If you smoke and you want to maintain sexual health after 40, you need to quit. There's no negotiation here beyond erectile dysfunction. Smoking causes bladder cancer. I see this constantly in my practice, and bladder cancer is one of the worst cancers you can get because the treatment is so invasive. We have to look inside the bladder with cameras repeatedly. Often, surgery is required, and these are major surgeries that fundamentally change your life. But smoking is just the beginning. Your overall lifestyle is absolutely critical for penile health. This isn't sexy, it's not quick, it's not easy. But it's essential. Remember what I mentioned earlier. 14% of men with erectile dysfunction have a heart attack within 7 years. Erectile dysfunction is a biomarker, a measurable indicator of your overall health. It reflects your blood flow, your cardiovascular function, your hormonal balance, your stress levels, and your lifestyle choices. Here's what I want you to do. Eat a healthy diet. Stop smoking. Avoid recreational drugs or use them only occasionally. Exercise regularly, and I mean real exercise. Aerobic exercise is crucial for blood flow. I'm talking about at least 45 minutes of vigorous aerobic activity at least 3 times per week. Running, cycling, swimming, intense walking, these all count. Aerobic exercise improves cardiovascular function, which directly improves erectile function. Resistance training is equally important because it boosts testosterone. Lifting weights, doing bodyweight exercises, using resistance bands, these maintain muscle mass and hormonal health, both critical after 40. If you don't know where to start, take it one small step at a time. I recommend the book Atomic Habits by James Clear. You can apply those principles to build sustainable healthy habits that compound over time. And finally, manage your stress. Chronic stress is a silent killer of sexual function. Some stress is healthy and necessary, damages your ability to maintain erections, decreases your sex drive, and affects your overall health. Find what works for you: meditation, therapy, exercise, time in nature, time with loved ones, and prioritize stress reduction as a health investment. Number 9. Be nice to yourself. This is something I see constantly. Men being incredibly hard on themselves about their sexual performance and their bodies. They're stressed about how their penis looks. They're anxious about how it performs. They're worried about their partner's perception. This anxiety creates a vicious cycle. Here's how it works. You have one sexual encounter where you can't get or maintain an erection. It happens to every man at some point. But instead of letting it go, you ruminate about it. The next time you're with your partner, you're thinking about that previous failure the entire time. That anxiety and stress makes it even harder to get an erection. And now you can't, which confirms your fears, which amplifies your stress, which makes the next encounter even harder. I want you to understand something fundamental. Everyone has fluctuations in sexual function. Every man, at every age, experiences times when his penis doesn't work exactly as he wants. It doesn't mean something is broken. It doesn't mean you're failing. It's a normal part of being human. What I'm asking you to do is be kind to yourself. Don't enter a spiral of self-criticism and shame. Those emotions make everything worse. If something doesn't work one time, let it go. Your body will recover, your function will return. Also, please talk